City. This effort started for real last night. There's been a second case reported in Westchester, as you all know. At this moment, we don't know whether that patient traveled to New York City using public transportation or not. To be clear, we're transportation experts, not medical experts. As such, we're following the guidance of the CDC, the State Department of Health, and public health professionals. We want New Yorkers to know that we're doing everything possible to keep our customers safe. Your safety is our highest priority, and as such, we're going above and beyond recommendations from health experts to disinfect the system. New York City Transit, MTA Bus, Access-A-Ride, Long Island Railroad, and Metro North have significantly increased the frequency and intensity of disinfecting procedures at each of its stations and on its full fleet of rolling stock. Trains, cars, and buses will be cleaned daily, with the MTA's full fleet being disinfected every 72 hours. Frequently used surfaces and stations such as turnstiles, MetroCard and ticket vending machines, elevators, escalators, benches, and handrails will be disinfected daily using EPA-approved and CDC-endorsed disinfectants. Update. So far, New York City Transit has disinfected 427 stations starting at 5 o'clock last night and 1,905 cars. MTA buses disinfected 1,974 buses last night and plans to do another 1,900 tonight. We're on track to do 5,700 buses, the full fleet, within 72 hours. Metro North has disinfected 60% of its fleet rolling stock and 64 of its 124 stations. The rest are being completed today. Long Island Railroad has disinfected its 3 busiest terminals, Jamaica, Penn Station, and Atlantic Terminal. An additional 121 stations are being cleaned as we speak. 300 Long Island Railroad cars have been cleaned in the last 24 hours. And I'll note that Access-A-Ride has disinfected 100% of its vans. That's 1,341 vehicles. Some of the Access-A-Ride population is medically vulnerable, and it was important to us that we disinfect all of those. Again, we're working in close coordination with the governor and state and federal health authorities. We continue to closely monitor the situation and take all necessary actions to ensure our system remains safe for our customers and employees. Before I turn it over to my colleague, MTA Chief Security Officer Pat Warren, I just wanted to note that this morning I took a Long Island Railroad train in the 6 o'clock hour, took it to Penn, got on the 3, I think it was the 3, to Grand Central, took the shuttle to Grand Central Terminal, and then took the 4 or 5 back down here. And I'll let Pat talk about his commute, but let me turn it over to him.
Thanks, Pat. A few points. Together with our labor partners, we are working around the clock with health officials at every level of government to formulate the best response to the novel coronavirus. Also, we advise our customers and employees to continue to follow CDC guidance. The best defense remains good hygiene. It's worth knowing that health experts say you should go about your lives as usual. We continue to a constant communication with our customers, and we are rolling out new public service announcements across New York City Transit, Metro North Railroad, and Long Island Railroad. Our new announcements will say the following. Hello, everyone. Keep yourself and your neighbors healthy by washing your hands often. Use soap and water and wash for at least 20 seconds. Or use hand sanitizer. Please cover your nose and mouth with your elbow when you cough or sneeze. Let's work together to keep New York healthy. These the public service announcements also complement customer messaging already deployed across our thousands of subway screens and bus screens, as well as our 84 subway stations and over 550 railroad screens. As health experts have said, please stick to the basic practices you would use during any flu season. Avoid close contact with people who are sick. Avoid touching your eyes, nose, or mouth, and clean and disinfect frequently touched objects and surfaces. Further, if you feel sick, stay home and consult your health advisor. Another area for consideration is if you plan to travel. The CDC has posted travel warnings and restrictions on its website. These include if you have symptoms and have recently traveled to China, Iran, or at risk areas such as Italy and South Korea, or you have been in close contact with someone who has been in those areas, seek medical attention. Regarding MTA's readiness, the MTA has stockpiles of hygienic supplies on hand and continues to procure cleaning materials and has contingency plans for everything from health to weather events. We've also extended our hours for our employees to get flu shots during the day at our various medical centers for free. That concludes my remarks. And just for my one other thing, my ride. So I take the 6, the 4, and the 5 as I come to work today, and I noticed the same crowds that were out there every day. So I feel confident that New York is handling this well.
Great, thanks. We'll take questions.
Did I hear you correct? I'm sorry. Did I hear
Please,
you
go ahead.
correct? I just wanted to double check. Did I hear you correctly that you're giving time to MTA employees to go and get flu shots?
Yes, and furthermore, we extended the hours so that they can. There are more hours in the day that the health facilities are open. They can get the flu shot. We always give flu. Yeah, we always get it. We just extended the hours for this event.
Hi, Pat. Given the fact that the Westchester case, there's been enough lead time for them to make decisions on whether or not to close schools, would you have, as an agency, like to have known by now whether or not this individual used Metro North to commute to work, knowing that he worked in Manhattan? And if you do find out that he did use Metro North or a particular line, what can be done to improve the conditions there?
Obviously, the more facts known about a patient or a situation, the better off. What we will do is we'll take advice from the CDC and public health professionals as to what actions we ought to take, whether additional cleaning is appropriate, but we'll determine that in close consultation with the CDC and the State Department of Health and the New York City Health Commissioner as well. Dan.
Wanted to ask about disinfecting in 72 hours. So I understand the logistics. Cars are not always in the yards for this, but how is this symbolic, or is there an actual, 72 hours, there's a disinfectant? I mean, how long does that last? Is this really going to make a difference in the cleanliness and dealing with the
Dan,
spread of virus?
This is not symbolic at all. This is a substantial investment of time and resources and a substantial increase in both the frequency and intensity of disinfecting both stations and rolling stock at each of these agencies and every one of the accessible paratransit vehicles. It's not symbolic. It is real, and we think it will do two things. It will decrease the presence of viruses, both the COVID-19 and others, on our facilities, but it will also give passengers, our customers, a sense that we're doing everything we can. And we think it's entirely appropriate under the circumstances.
What's just the level of disinfectant? How long does it last? Because if you're saying every 72 hours the whole fleet gets disinfected, how long does that disinfecting last on a typical train car?
Look, I don't have the answer to that. We'll come back to that. It's important to note we're using EPA-approved and CDC-recommended cleaning solutions. We've also run them by health professionals. I spoke personally to the New York State Commissioner of Health and to our internal public health folks here. I will say that we're also looking at other products that are being used in other systems and situations, and we're doing that on a current basis, and it may be that we'll be supplementing the solutions that we'll use, and we'll keep you posted on that. Rich Lamb.
I was just going to say, I might be getting a little bit too much into the weeds. I'm sorry. I might be getting a little bit too much into the weeds here, but what are they spraying the inside of the car? Is somebody in a special suit doing this? Do we know the actual, what the disinfecting process is like?
Yeah, Rich, first of all, as to the solutions, there's a whole list of EPA-approved and CDC-sanctioned or approved or recommended solutions. Each of the solutions that were being used is on that list. As that list is enhanced, we'll look at what's added to it. People are using these materials with gloves and whatever other PPE medical professionals recommend. David.
You mentioned anecdotally that ridership does not appear to have gone down. Do you have numbers to back that up? Are you concerned that ridership might drop? And Third question, is there a concern that on more crowded lines, fear around this virus spreading could cause chaos, and how are you controlling that or working?
Well, look, first of all, every one of our lines is crowded. Ridership has been up. New Yorkers are used to challenges. I think New Yorkers have responded appropriately. We're committed to, as is Governor Cuomo, we're committed to communicating on a regular basis with our customers. And we're going to take whatever actions are necessary recommended by CDC, the Department of Health, the Commissioner of Health, and medical professionals going forward, as we have to date. Please. Yeah, sorry, David. The ridership data right now, we believe it's unchanged. Certainly, that's my anecdotal. I've asked Mario and his teams to look at the ridership. There does not appear to be any increase in bridge and tunnel crossings. And ridership anecdotally and from employees, Long Island Railroad, Metro North, subways, buses, paratransit is what we'd expect this time of year. Please.
Thank you. Who is doing the cleaning? Are they trained in any specific way to know how to do it? Is there overtime involved, or are you bringing in, let's say, additional people or experts?
So the answer is on the subways, TWU workers who are highly skilled and highly trained, and they have the appropriate equipment. On the Long Island Railroad and Metro North, Long Island Railroad and Metro North forces, these folks are used to cleaning and disinfecting stations and rolling stock. We're just doing it with a much higher degree of intensity and frequency. Clayton.
You mentioned that you're cleaning the accessorized vans, but you're doing more and more rides with taxi cabs now. What conversations have you had with the TLC and taxi cab operators about sanitizing those vehicles?
Good question. Met with the TLC, the new TLC commissioner earlier today. We've asked that we obviously don't control those vehicles as we do the accessorized vehicles we control under contract. Metro North, Long Island Railroad, New York City Transit, obviously we own and operate those, and we've asked those providing services to our accessible customers that the same precautions be taken.
And you're following up with them to make sure they're doing that?
We are. Please.
Hi, good afternoon. So I read that there would be PSAs in the subway, so what would the message be?
I'm going to turn to my colleague who will... Yes.
You really want me to read again? All right.
I do.
All right. All right. It says, hello, everyone. Keep yourself and your neighbors healthy by washing your hands often. Use soap and water and wash for at least 20 seconds. Or use hand sanitizer. Please cover your nose and mouth with your elbow when you cough or sneeze. Let's work together to keep New York healthy.
It was a little more emotive the first time.
And sorry, how often would that be said?
It's woven into our regular routine of announcements. So frequently, I don't know how often it is, but it's frequent.
Alfonso, sorry.
Hi. From listening to those numbers, it sounded like Long Island Railroad wasn't as far along in the sanitizing as some of the other agencies. You said they did the 3 main stations, and the others were, I guess, in progress. Are there any specific challenges with the Long Island Railroad, or any reason why maybe it wouldn't be as high a priority as some of the other agencies?
So I don't agree actually with the premise. On the rolling stock side, 300 cars have been disinfected in the last 24 hours. And as I said, Long Island Railroad's on the same 72-hour schedule. 120, so Jamaica, Penn, and other stations were disinfected last night. An additional, the remaining stations are being disinfected as we speak. And the stations on the Long Island Railroad will be, as in the case of Metro North and the subways, disinfected every day.
Mark, you have something?
Mark.
Anybody else?
Yep.
All right, hang on, Steve. Go ahead.
Given that you all are not medical professionals, as you said, can you still offer subway and bus riders, particularly, any reassurance about whether this can be contracted or transmitted from a hard surface, like a metal surface, like a subway pole or anything like that?
So that's why we're disinfecting the cars, and that's why we're disinfecting the stations. The advice, the actions we're taking are based on the advice of CDC, the State Department of Health, the New York City Department of Health Commissioner, and public health professionals. Cleaning and disinfecting rather hard surfaces is part of the recommendation. It's part of the protocol. We're going to do it in stations, we're going to do it in cars, and we'll do it as long as this situation prevails. Steve?
As far as this coronavirus, as soon as an infected person gets on a train car and touches a pole, the virus is going to be on that pole. So even if you just cleaned it, that car will now be infected for another 72 hours. So I guess I'm just curious what it...
First, I don't agree with the premise that the car is infected, right?
The pole, if someone touches a pole.
The virus may be for some period of time present and a risk to customers, just to be clear.
So why go through so much effort to clean the cars every 72 hours? Is there a different cleaning method that could be done that would be more effective?
Well, we think we're using EPA recommended and CDC recommended cleaning solutions. So point one. Point two, we're going to be we're actively exploring since last week the use of other solutions that either are not on the EPA list and perhaps ought to be included. So we're going to see what other systems around, and we've reached out to, for instance, transit systems in Japan, in Europe, and obviously those around the United States. We think what we're doing is, frankly, the most aggressive, and the increase in frequency and intensity we think is the appropriate action, and it's all based on advice of medical professionals. That's the way we've conducted ourselves since this situation arose, and we're going to continue to do that going forward.
We got Rich and then David and then Matt.
Rich.
So just on, I'm trying to get a sense of how the cleaning is being done. Are they wiping it down by hand? Are they spraying it with some kind of a device and just going through, or how is it a combination?
Yeah,
Do we have any sense?
do you want to?
There's a picture on the wall.
Yeah.
It's basically being done by, I'm sorry. It's basically being done by, at the present time, by wiping. I mean, there's spray bottles and stuff, but wiping's part of it. There are protocols that can use some kind of misting and other systems out there that we're looking into right now, but currently, initial push is using wipes and sanitizer.
Pat, you mentioned we don't know yet whether this gentleman in Westchester took the train. Let's say in an hour you find out that he did take Metro North maybe 2 days ago. What's the immediate response to that type of situation?
The immediate response is, and we've had these discussions, is talk to the CDC, talk to the Department of Health, talk to the public health professionals. We're going to take their advice every step of the way, and we will keep the public informed as to what we're doing. The last thing, is that the last question? Yes. The last thing I'll say is my plan tonight is to take the Long Island Railroad back to Port Washington. I'll get there by taking the 2, 3, and the 1. And you?
I'll be back on the 6, 4, 5.
Good, Sarah?
Likely the 4, 5.
There you go. Thanks, everybody.
Thank you.
I think the message is that none of our routines is changing.
Good.